Good afternoon, everyone, and welcome. Welcome to tonight's event, and thank you so much for supporting our Third Wednesday programs. Tonight, we have a special treat, or this afternoon, I should say. We have Dr. Carolyn McCabe, who's going to be speaking to us. She is a staff scientist with our Department of Population Health Sciences, which is part of our research institute here at Geisinger. Dr. McCabe got her bachelor in biology from Emory University, and she got her master's and her PhD in nutritional sciences from the University of Michigan School of Public Health. Her interests lie in development origins of health and disease. She looks at how everyday chemical exposure can affect pregnant people and their babies, and how those exposures might influence health down the line. Her work focuses on finding practical ways to spot these exposures, especially in the communities that may be more affected. In addition, she compares how day-to-day parenting choices early in a child's life can shape their risk of obesity, and how listening more closely to what parents and patients say during routine pregnancy and pediatric visits can help doctors better support healthier outcomes. So please join us in welcoming Dr. McCabe.
Thank you. That was a really lovely introduction. Hopefully I'm in the frame here, but thanks everyone for coming and here, like Jen said, on these Wednesday programs to hear me sort of nerd out, I guess, about this topic. It's something that I have, committed my time and research to over the past almost 10 years, and hopefully I'll continue to do that moving forward. I would say there are two sort of foundational pillars that I'm going to emphasize today. And the first one is sort of the who, what, where, when, why, right? We always like to launch into these conversations with that, especially when it comes to environmental chemicals, which is a very broad topic. And so I don't intend to go super deep into anything in particular or any one chemical today, but hopefully give you an overview. And then the other is that with Earth Day around the corner, the phrase that is often used for that applies nicely with what I'm going to talk about today, which is that small changes can have a big impact. So with that, I'll launch in. So these are some of the learning objectives for today. We're going to, again, sort of that who, what, where, when, why, what different types of chemicals are, why we care about them, what types of evidence exists that suggests that these exposures are not great for us, ways that we can prevent or modify the impact of those exposures on our bodies. And then I'm going to talk a little bit about there is, as you know, Geisinger has other locations down in Danville, and so there's sort of an environmental exposure relevant event that's happening down there that I'm a part of. So I'll talk a little bit about that. Feel free certainly to raise your hand and stop me if there's anything that's confusing. I'm happy to take questions and talk through these things. So Anne gave me a really nice tee off with the idea of this theory, and I want to share it and talk a little bit about it just because it fits really nicely into the why. And it's a pretty foundational theory in the study of environmental exposures, and that's the developmental origins of health and disease. And pretty simply, it's this idea that early life exposures, and oftentimes we're focusing on this in utero environment or the prenatal environment, can potentially have a big impact on the occurrence or the severity of later life disease. I also wanted to bring in this model, and we're not going to, I'm not testing anybody on this, so we don't have to get deep in the weeds, but a lot of what I want to emphasize with this particular model is this idea of, like we're talking about today, environmental exposures during what would be sensitive windows. And so that's during pregnancy, that's during early childhood. You can sort of imagine when these sensitive periods are. And through a variety of different mechanisms, those exposures can potentially lead to negative child health outcomes, but could also potentially lead to adult health outcomes. And as I was driving up here today, I wanted to think of another metaphor that might sort of solidify this even further. And one that we often talk about is if you think about a bow and arrow and the normal trajectory of that arrow once it's launched, you can sort of predict it might have a normal curve or a typical curve. And with things like environmental exposures and things we're going to talk about today, it's almost as if someone might have come and bumped the archer right before they take that shot. So that arrow may not have that typical course, and certainly it could end up in a variety of different places, but hopefully that helps give a little bit of a better idea of what I mean when we're talking about increased risk or some of these different outcomes. I bemoan topics or talks that start with heavy definitions, so I'm not going to read this in detail, but a lot of what I wanted to lay the foundation with this is this idea of what is an environmental chemical, and a lot of times we talk about, or a specific class that I'm particularly interested in or study is a class of chemicals or a group of chemicals that might be endocrine disrupting chemicals. So what does that mean? And it's basically that we have within our body, we have normal processes that help, create hormones and process hormones, keep our body moving properly. And these chemicals can, through a variety of ways, interfere with those normal processes. And so that's really part of why, or the other half of why we care about these exposures, because it's happening. They're happening potentially at developmentally sensitive windows, and then we know that those windows and processes are sensitive to the types of chemicals that exist. So next I wanted to sort of talk about sources of exposure and broadly touch on some of the different classes of chemicals that we might be thinking about. And so if we start sort of at the 12 o'clock, we have metals, heavy metals. This might be, lead or cadmium or arsenic. Lead is a pretty common one that we might have in our old pipes in our homes, in the paint in our old homes. I live in a home that's 150 years old, so that's something that I often think about. Arsenic and cadmium can show up in things even like as unsuspecting as Halloween candy. Then the next one, this idea of polycyclic aromatic hydrocarbons, this really occurs as it relates to burning coal or oil or gas or wood. And so this can be relevant, especially for those of us who have maybe a wood-burning stove in our home, or if we have a gas range, or some of these other similar things. Then we have phytoestrogens, which is really just a fancy name for soy and soybean products, which we know those can be in a variety of different things. And then we also have agrochemicals. Certainly here in Pennsylvania, we're familiar with our farmlands, and that may not be surprising, the idea that pesticides have the potential to harm our bodies. But some of these other ones on sort of the left-hand side of this diagram, I think are the ones that might be the most surprising, and things that I will talk a little bit more about in the next couple of slides. And so personal care products can be a pretty significant source of these types of chemicals. So, this picture sort of demonstrates things like nail polish remover and nail polish, but up again at the 12 o'clock, we see a lotion bottle. And so I think a trend that you'll start to see is that we have things that an industry that is potentially very lucrative and uses these chemicals to make products more efficient, or to make products better or last longer or work, for whatever their intended purposes are. But then potentially the chemicals have a negative side effect. Sometimes pharmaceuticals, like what's referenced here in parentheses, even just our regular, our medication, like long-acting birth control or hormonal birth control, can potentially have a negative side effects. Industrial chemicals, and then this last one up at the sort of 11 o'clock here, plastics, which might come as a surprise. So there are a variety of chemicals that might exist in our water bottles, BPA is one that I'm sure is a hot number that you've heard, BPA in water bottles. That's a chemical that I studied during my master's and PhD. But even things as like the lining of tin cans and the toys that our kids play with. So it's this particular slide can feel really overwhelming, and this talk in general can feel really overwhelming because you look at it and you say, well, that kind of looks like these chemicals are in everything, and you would not be wrong to feel that way. And so that general idea can be certainly, well, what's next? What do we do about stuff like this? And this is where I would reference what I said in the beginning, that small changes can make a big difference. So again, it's not all bad news. And this coming from someone who sort of is in this world all the time. There are some, there's some great evidence, and then we'll talk about things in a few slides as far as steps that we can take to lower our exposure, that we can potentially do to mitigate if we can't avoid being exposed to these chemicals. But this slide is sort of to talk about the idea that there are some good things happening at the federal and local level to sort of work to reduce the population's exposure to these things. But of course, one thing that I also wanted to acknowledge when talking about this topic is that it does generally place a really big burden on you and me to have to look at labels, to understand what things mean. And so, I want to leave space for that because it is something that we have to do, unfortunately. But there are, like I said, a couple of sort of keywords that you can utilize that kind of give you a hint to what might be in a product. And then there are some swaps, I guess you could say. And so this next slide is a try this, not try that, or try this, not that. But one of the caveats, I guess, that I want to also provide is that, when I first learned about these things, the tendency is to think, oh, well, I just need to get rid of all my stuff. But like that's not a feasible option, and it's also not sustainable, especially when we think about Earth Day, right? It's not a good idea to just add more things to the landfill. And so one of the things that I want to try and carry through with this particular slide, but as you move through the rest of your day today or your week after you leave here is the idea of noticing, like having a bit more understanding now of what these items of concern might be, but also just starting to notice what you're using as part of your personal care product lineup, or what things exist in your kitchen. And as something breaks, as a Tupperware breaks down or gets a hole in it or whatever, and you need to replace it, what kinds of options can you consider instead? So one sort of entry point could be thinking about the composition of your clothing. And that's a little surprising, but a lot of clothing contains man-made synthetic fibers, which polyester, rayon, sort of, nylon, that sort of runs the gamut of a plastic-based product. And our skin is one of our biggest organs. So in theory, we're absorbing some of that. And so as you need to replace items in your closet, this is where I would say consider things that are mostly cotton or wool or hemp or some of these other items. And certainly there are blends now too, where you might get 70% cotton and you'll have 60% polyester or 30% polyester, which again, small changes can make a big impact. Again, down here on the left is this idea of plastic versus glass food storage. So I am by no means, again, suggesting you go home and throw out all of your plastic Tupperware, but one simple change could be avoiding heating your leftovers or your lunch or whatever within your plastic Tupperware. So if you do store food in a plastic Tupperware container, make sure that it's cold before you put it in there. So if you're using something for like soup, try and make sure that soup is pretty cold before you put it in that plastic container, and avoid reheating your lunch or whatever you're consuming within that plastic. So put it on a plate or something of that nature. That will go a long way because a lot of these chemicals that like BPA, for example, that exist within plastic will be released through that heating process. Yeah.
Would that go for washing plastic containers in the dishwasher
So that's an excellent question. I still put,
Do you need, repeating the question, would that go for washing plastic containers in the dishwasher?
so that I would say launches us into this other conversation as it relates to like microplastics, which I wasn't necessarily going to get into today, but no. This is all good. I love talking about this stuff. So I I I still put my plastic Tupperware in the dishwasher, but it's one of those things too where if it's feasible for you to hand wash, then that's something that you could always do. But it does that. There is this other idea of yes, microplastics that might be released through the heating in the dishwasher and then get into our water supply, and that's something that science hasn't perfectly figured out yet as far as removing those from our water.
So, and I'm asking this as a parental standpoint because I don't buy a lot of glass Tupperware because they drop a lot of that.
Yeah.
So when you're saying don't warm it up in plastic, if your plates are plastic, would that like be the same difference to do that or?
Unfortunately, yes. And so this is where certainly paper products can come in. I think, disposable paper products are always an option. I have a 2-year-old and I have made the mistake far too many times of trying to give him glass with those suction cups, but I have found some good options as it relates to silicone. So that's an excellent replacement with kids is these silicone-based that had the little extra suction cup on the bottom. Those plates and dishes and things like that work really well. But yes, that is. I understand that element too of trying not to lose all of your dishes to your kids. But I have found success with the silicone plates, and then I've also found success. There are like a silicone and stainless steel combos, and those work really well too. And the stainless steel I put in the dishwasher too, so that's always nice. Some other things to think about, and this middle square on the bottom is a very large box when we're thinking about cleaning products or we're thinking about personal care products. Again, I don't think that it's reasonable to go home and get rid of all the things that you have, but as you need to buy a new deodorant or you need to get new laundry soap or you need to, as you finish products within your home, my hope is to give you a little bit of know-how to think about, okay, what other options might exist on the shelf and take a peek at them. I've certainly noticed over the past couple of years that, Giant and Walmart and Wise, they have started to have their own version of a slightly more natural product. This maybe I'm preaching to the choir in the sense that we know that sometimes natural can just mean anything and may not mean that it's safer. But one good tip off is in the ingredients list if there's fragrance, if there's just this blanket word of fragrance. Or other natural flavors, right? Maybe you've seen that on your food products. That's usually a tip off that there's something else in there, and that is commonly known as phthalates, which are also potentially an endocrine disrupting chemical. So, and we know fragrance can be in anything. So this is where simple swaps might be. You might not need that boost, the granules that you'll add to your washing machine to add extra scent, or considering soy-based candles, or considering not using your Glade plugins. Like those are simple options, and it can be overwhelming if you walk into your home and you're like, oh, I have that, and I have that, and I have that. But again, it's just slowly observing those things, and that's again my hope is that you're able to sort of take a peek at what comes into your home and what leaves your home or what you're using in your daily life, and look at it with a slightly different lens. These other two boxes here are things that I wanted to include because they are parts of our home, certainly the cooktops that we use, but I don't think that it, again, is a super feasible idea for us all to just go out and buy induction cooktops because those are not super cheap. And then fracking is also something that not a lot, I and you don't have a lot of control over, but that is potentially also a contributor to some of these exposures. So before I move on, any other questions, thoughts, curiosities about some of the things that we might be exposed to?
Dr. McCabe, we do have a question online that we might as well take now.
Yeah.
What is the actual reduction in exposure from implementing these measures and how is that measured? And second part, have there been prospective trials that show efficacy of implementing these small individual practices?
That is an excellent question. I can't give you 3 references that detail the particular efficacy, but I can, at least the first question I'll start with, which is how do we measure sort of our exposures to these chemicals? So a lot of these chemicals will be measured in the urine because some of them are excreted pretty, processed through the body and excreted pretty quickly. So they'll have a short half-life. And with that statement, you might be saying, well, if our body can process them quickly and excrete them, why do we really care that we're exposed to them? And the part of that is that, unfortunately, it's not just a one-time exposure. If you're thinking about the products that you use from the moment you wake up to the moment you go to bed, and then you multiply that by 365 days in the year, and however, that you are exposed to these things all of the time. As far as the second question, and then there are some other chemicals that we can measure in the blood. So PFAS, the forever chemicals, which maybe you've seen pop up in the news, those have a much longer half-life. So typically we'll measure those in the serum. And I've recently started collaborating with someone at Carnegie Mellon who's able to use whole blood to look at the quantifying blood PFAS levels, which is pretty cool. When it comes to prospective trials, there are a couple different studies that exist. One very large one is the ECHO cohort, and they do a lot with families and look at exposure to these environmental chemicals and then the potential health impacts. But there is another group at Harvard who has looked at and done a couple different cohort studies where they look at the use of certain hair products as it relates to pregnancy outcomes. So the length of the pregnancy, if babies are born preterm, and they have found success or demonstrated that reducing use of products, especially in the 3rd trimester, can have positive impacts on some of these birth outcomes. I'm sure there are many more, but like I said, I would have to think a little bit longer to pull up those references. But those are excellent questions for sure.
Thank you for saying hair products, because I was going to ask, being someone who've used relaxers since I was 8 until 27, how, now we know that those were causing cancer if you're using them excessively. How are companies able to sell chemicals that are killing people or stores not reducing the products that they have versus using their own store brands? Why aren't there more, like when you go in the store, 75% of their brands versus 100% of P&G?
Yeah.
Or not P&G like that, but
yeah.
If I wasn't supposed to say that, sorry.
No, that's an excellent question. So one of the loopholes that I guess exists in the United States is that the Federal Food and Drug Commission, I'm not going to be able to remember the name of the act, but basically the policy that would regulate the ingredients that are in these products was last updated in the 50s. And so that's sort of the major loophole that exists in the United States. And it's much more stringent in Europe and in other countries as it relates to these chemicals. So you have hit the nail on the head as far as I think one of the bigger problems that exists in the US as it relates to why companies can still continue to produce these products and use these chemicals. And like I said, it's a very, very lucrative industry. So it wouldn't be a surprise to know that there are lobbyists and there are interest groups that ensure that those chemicals are still used. But you do bring up a really great point, which is, so there are a lot of different mobile apps I'm sure that's not a surprise. And I hate to add to your list of things to put on your phone. But one that I have used and have found to be pretty user-friendly is called the Yucca app. So its logo looks like a carrot. It's like a very simple designed carrot. And basically when you're in the store, of course there's like a paid version of the app, but the free version of the app works quite well. And you just scan the barcode of the product when you're in the store, and it will give you sort of a summary of and a score out of 100 of that product. And it will also list the different ingredients, and it will give those individual ingredients a score, so you can sort of do sort of your own risk calculation where you're like, well, there's only one really, really bad ingredient. I'm going to continue to use this, you know? And then it will list sort of like the overarching synthesis of what the product may be linked to. Like, oh, well, it's linked to, you know, sensitivity or allergies, or does have potentially reproductive consequences. And you can look at the individual ingredients, and they'll provide citations if you really want to go down that rabbit hole. So I have found that to be a pretty quick and easy way. And like I've said, I've found good and safe products in Walmart and in Target and Giant. And so that usually helps me direct. It's unlikely that you're going to find something that's 100%, you know, but at least you can make some of these other changes.
In your opinion, what EDC would pose the like worst effect on your body? What would you say?
Really good question. As far as I would probably say phthalates, because they are in a lot of personal care products. And so those are the things where you have fragrance, and they can be in a lot of different forms in that sense. But I would say that is closely tied with PFAS compounds, because, and we'll talk a little bit about it in a few slides, but PFAS compounds are the things that are non-stick, are water repellent, are you know, and so those can also be pretty significant. But the phthalates are the thing that I think we have some of the easiest control of as it relates to our personal care products. Yeah. So again, I don't want to leave you all with this idea of like, what am I going to do? Because that's not that's not a helpful thing, right? It's really, truly small changes can make a big impact. Yeah.
So where it says transparent ingredients, you're just talking about it doesn't have a vague fragrances or natural flavors or whatever the.
Yeah, exactly. Like you get a true ingredient list, and that's certainly up to the company as well if they're going to do that. But I think the idea of transparent may be tricky in the sense that I'm not a chemist, maybe you're not a chemist, and so we may not know exactly. It may list the ingredient, but we may not know exactly what it is. But transparent, yes, in the sense that we have those details accessible to us. So this particular slide in this section, I just wanted to bring up as it relates to yes, we can make changes in the products that we use and bring into our home, but also, and you know, what if there are any doctors on the line, or, you know, given that we're at Geisinger, everyone should be pleased to know that we also have increasing evidence that our diet, our physical activity, our health behaviors in general can also do a lot to mitigate the impact of the effect of these chemicals on our body. So having a diet high in fiber, lots of fruits and vegetables, that can help support our body's natural processes of, you know, of elimination of, you know, which it already does really, really well. So you don't need to do any juice cleanses or anything like that. I have to say that as a nutritionist. There's increasing evidence that, you know, physical activity, just being outside and exercising, those are all good things. So all of the things that support our body in general and are good for us can also help limit the negative effect that these chemicals can have on our body, whether it's preventing how much our body absorbs or helping our body eliminate those things. So as I sort of teed up in the beginning and talked about, I wanted to spend the next couple of slides talking about an issue in the Geisinger community that is, related to our talk in general. And specifically, it's related to PFAS. And so again, I share this slide just to provide baseline information, but the points that I would say that are key and what you may have heard as it relates to PFAS are those forever chemicals. And they're called forever chemicals because they contain a particular bond within their chemical structure that are very strong. So it means that they exist in the environment and in our bodies for a really long time. And so these, in general, PFAS are used to make coatings for products that are flame retardant or stain resistant or water resistant or grease resistant. So unfortunately, again, that kind of brings up a list of a lot of different things that we can find PFAS in. All the way from popcorn bags, which that was a new one to me, all the way to candy wrappers and shampoo. So part of why we are concerned about PFAS in the environment links to what I just said, which as it relates to how difficult it is for them to be broken down or to break down. And so often a lot of the main sort of source of PFAS exposure is our water and also. So how does PFAS often get into the water? And typically that might be through industrial processes that use PFAS in their production. So one good example is carpet manufacturing. And that particular piece is relevant to the community issue that's happening down in the Danville or Bloomsburg area. And so let's say that factory is connected to the wastewater system, and so their wastewater discharge might get integrated into the local streams, or it might go to the wastewater treatment plant. And it's surprisingly not an uncommon practice for municipal authorities to send those biosolids to the landfill or send those biosolids to farmland. And so you can sort of see how then that through land erosion or through the use of that farmland, it might then get into our water system through our private wells and things of that nature. So PFAS has a variety of different health effects that have been investigated. None of these are causal, but there are associations as it relates to exposure. And so these are particularly prevalent for, again, these sensitive developmental periods. So during pregnancy, and then also can have impacts for later life disease as well. So I was just going to share a little bit about some more background and details about what's happening down in the central region. So in March of 2024, the Department of Environmental Protection in Pennsylvania, they often do, as we may or may not know, they'll do water quality sampling across the state, across the Commonwealth, and they recently added testing PFAS to their panel of water tests. And so they were doing water quality sampling at a public water system at a place called Brookside Village Mobile Home Park. So that's located in North Center Township, which is in Columbia County. So if you know where Bloomsburg is, it's about an hour, it's west of here, west of here, and it's a stone's throw from Geisinger Central Campus. And so through this initial testing, they detected 2 common PFAS compounds that were very, very, very high and well above the standards for drinking water. And so that prompted an investigation by DEP, and so they wanted to sort of see what's going on here. Ultimately, they determined that the municipal authority in North Center Township had a program beginning in the late 80s to around the late 90s where they approved the spread of human biosolids on farmland. And so most likely we know now that it was, again, carpet manufacturing is pretty big down there. So most likely that sort of cycle that I talked about before is how those human biosolids were contaminated with PFAS, and then how they ended up on, farmlands, and then potentially compromising the water in this area. So a local resident of North Center Township reached out to Geisinger and said, hey, this is happening here. I'm not sure if you know, but we think this would be a great opportunity for research. So myself and my colleagues at the Center for Community Environment and Health have partnered with the community members there to do a study. And so that study, I'm going to talk about in the next slide. Well, it's called the PERSIST study. And so with this particular study, we are going to utilize something called geographic information systems technology to look at some of these maps that I showed. This one in particular is made by our GIS specialist, and so it allows us to leverage a lot of the publicly available data that exists through the census tract data and things of this nature to be able to look at the area and then also map participants and their water levels and or their blood PFAS levels. So we're going to recruit participants to look again at sort of the geographic distribution of this exposure. Participants are also going to donate blood, and we're going to be able to quantify the blood PFAS in their blood PFAS levels in their blood. And then we're also going to collect survey data related to lifestyle and environmental exposures, because although it's very possible that their water, their wells, or if they're part of the public water system, that was the main source of exposure, we also know based on our other slides that it's very possible that there's other things that might be contributing to their levels as well. So we are very close to launching, and our initial pilot study will be able to enroll about 200 participants, but we're really hopeful that in the past couple of months, I've had a chance to talk with DEP and the Department of Health and folks across the Commonwealth, other researchers that are studying PFAS, and so we're really hopeful that we'll be able to acquire some additional grants that would allow us to include more of the region. And certainly this issue is not unique to the Commonwealth, not unique to the state of Pennsylvania, and it's not unique to the country. So certainly it would be good to be able to include more of our neighbors. I wanted to take a minute to talk a little bit about minimizing exposure here, because again, it's not all bad news. Yes, we're exposed to these things, but there are ways that we can minimize our exposure. And so like I mentioned earlier, drinking water and diet are the primary routes by which we might be exposed to these chemicals. And so certainly if you live in an area that has documented contamination, it's recommended to not drink or cook with that water. And really the main way to mitigate this would be water filtration. So there are a lot of different water filtration devices that exist out there. Brita and Zero Water and Culligan, they all have different options at different price points, which still do a really good job at eliminating some of these things in our water. Another big thing that I think is relevant for Pennsylvania is checking fish advisories. So for those of us who like to go and visit our local streams, it's important to make sure that the streams that we're visiting or fishing in don't have an avoid consuming fish advisory. And then again, yes, this idea of reading our consumer product labels. So I'm not saying go home and throw out all your nonstick pans, but as you notice wear and tear on your pans and you need to go get a new one, consider an aluminum or a stainless steel pan, or a ceramic pan, just as other options. And when we're thinking about like water repellent and stain resistant things, those are like Gore-Tex or some of these other different products that you might have heard of. So again, I want to make sure I say small changes make a big impact. And my hope again is to give you sort of an increased awareness of what we're seeing in our everyday life, but knowing that there are a lot of different things at our disposal that we can use to prevent sort of the major negative effects of these chemicals. Again, this is just to drive home that idea that we have increasing evidence about diets high in fiber, diets that are, have all of those good things for us, micronutrients that are in our fruits and vegetables. Those can go a really long way to helping prevent the effects of these chemicals. So with that, I'll stop and say thank you so much again for having me, and I will take any more questions.
I have a question. I'm curious about timeline. Like I've been around for 3/4 of a century, and when I grew up, things were different. My mother, all of our meals were pretty much home cooked.
Mhm.
I did grow up with a father who smoked, and we had coal heat. But I don't remember any nonstick pans. Our clothing was probably all cotton. And I'm just wondering how it's different than for children who grow up today, who grow up with fast food, who it's just a whole different lifestyle. And I'm wondering, like, the time, if anybody's ever done a study that compares, I don't know what the time frame is for accumulation for these types of chemicals in the body. And so I'm just curious as if anybody's ever checked like a generational difference. I mean, granted, now all my clothes come from Eddie Bauer, so they're all synthetic, but I'm just curious if there would be a difference.
Yeah, I think that's a great idea. I can't cite one off the top of my head, but certainly there's a lot of, and I think part of this, when we're thinking about what drives science and where sometimes the funding might exist, and so a lot of focus has certainly been placed on this prenatal period, early childhood, but also there's this element of following people can take a long time because it takes some time for us to age, right? But I will say that we do have a study here at Geisinger called the Geisinger Rural Aging Study, which was started by Dr. Christopher Still, and we have a lot of a pretty large cohort from that, which could be interesting to look at and see sort of what changes exist over time. But you make an excellent point, how the things that your generation may have faced when you were younger were very different and may not, have been
Lifestyles.
yeah, exactly. Yeah, absolutely. Absolutely. And that's not to say that we're not still impacted by the things that we put in our body as we age, but it certainly, provides some curiosity about the differences. Thank you for that question.
The PFAS chemicals how did those get into your body? Is it through consumption or is it absorbed through your skin? Or
So it would be a lot of it is through the water, through drinking water, but also through the air. So if we think about our carpets, or we think about the things that our furniture is made of, like that creates dust or plastic particles. And so those get into the air, and that's also how we can breathe them. But or how it might get into our bodies. And so at least a tip for that is, and that comes up a lot, is surprisingly, the recommendation is to just vacuum more and dust and things like that. Because if you're vacuuming and you're mopping and things like that, that helps consolidate whatever particles might exist on our floors and in the environment. Using air filtration devices in the home, those are also really important. Make sure, I just got new furnace filters today that come, so don't put that off, I guess. Those are different things that can help.
We have another question online. Do you trust plastics that claim to be BPA free?
That's like a question right to my heart, because it's tricky, because there's some marketing involved with the use of the term BPA free, because sometimes companies will put BPA free on a product that never had BPA in it to begin with, right? So they're saying that in order to sort of lure, like, this is so safe, but there are other chemicals. BPS and BPF are similar monikers essentially to BPA, which, once BPA started to get all this fanfare, companies were like, oh, well, we'll just use these other things. So just because it says BPA free, it may have those other things. That's where, as it relates to BPA, yes, plastic water bottles, food containers, receipts are a surprisingly common source of BPA and BPS. And so trying to avoid those. But it's similar to like gluten-free. You like pick up milk and it says gluten-free and you're like, well, yeah, of course that makes sense. Okay, well, I'll leave with this. These are my team members. Here's my email address. You know, I'm always happy and love to hear from the community. And if you have questions or follow-up or want more resources, I do have a resource slide at the end. It's most specific to PFAS, but you know, the Pennsylvania Department of Health does have great resources. Penn State Extension has great resources. They're doing great work too, as it relates to these things. Yeah.
We do have one more question online. There are recent examples, lead in Flint, fluoride in water in many states, of policy changes. Are there substances that don't have associated lobbyists where there is long-term reason for hope for policy change post this administration, or are there substances where it's pretty hopeless that anything besides individual level changes can happen? Can you expand a bit more on your earlier comments on when consumers should be optimistic that change can happen?
That's a great question. That's a great point. I think it's fair to say we vote with our dollars, and so if we're where we're spending our money and how we're spending our money, there's many companies that exist in the personal care product space that are, you know, we could say claim loosely or softly, I guess, to be safer for us. Unfortunately, in those spaces, it's still upon, you know, the burden is still placed upon us to double check. But I think the space that I have the greatest hope for is PFAS, especially even in the Commonwealth. There are many different state and local and state representatives that I've had the chance or will have the chance to speak to, and I know that legislation is being put forward in the Commonwealth to try and protect, you know, our residents from being exposed to these products. So I have a lot of hope there, and I do think that as we purchase things, you know, there's always businesses out there that are looking for opportunities to create products that meet the needs of the public. So I don't think that it's all for naught. And I'm certainly seeing it become part of a larger conversation, especially with our local and state reps. So that's encouraging to me, at the very least. Yeah.
Thank you. I think it's more of a comment than a question, but the Yuka app, I don't know how many people in the room here have used that. I've used that about 9 months now. And I am sensitive to a lot of this stuff. You know, they talk about the kids and the learning problems and, you know, why do people have so much breast cancer?
Sure.
So without getting into specifics of any of that, the Yuka app is really helpful. And what I want to comment on is they give the recommendations.
Yes, that's a great point.
And
Yeah.
that's the piece that has helped me. You're talking about fragrances. I mean, people with these car things, you walk in the house, I mean, you know,
Yeah.
it really does cause that congestion piece.
Yeah.
So I just wanted to comment on that Yuka piece. And with that said, one of the first things Basis soap. I don't know if anybody's familiar with that, but Basis soap. And, you know, I'm at home, I tell my wife, I'm scratching, I'm itching, I'm using Basis soap. It must be the heat, the dry this and that.
Mhm.
I use the Yuka app. One of the first things I check is Basis soap. The fragrance.
Yeah.
Dove sensitive skin, I think it is. I started using that like about 9 months ago. I have a whole new skin.
That's great.
So I
Yeah.
just want to reinforce that. Don't underestimate this Yuka app. It's really, there's so many different.
Yeah, and one small change. Yes. And I have used that app before, and I think it's important to think about with these apps, right? There are still organizations, they are still a company, they have motivations in creating these things. So that's to say, just like when we're trying to get information about what's going on in the world, using multiple sources is always a good idea. But yes, that's a great point about the Yuka app, is that it doesn't just leave you hanging. It will give you recommendations, and certainly Amazon is always good.
One more quick comment.
Sure.
He was going to buy gummy bears for his grandkids, and I scanned them with the Yuka app. Yeah, he ended up not buying them. I said, "Do you really want to do that to your grandkids? I mean, these are smart kids. Like, let's keep them that way."
Yes.
So the point is just how to reinforce that.
Yeah, exactly. That's excellent. I appreciate that. And that's, it's nice to have those little tools to sort of give, right? It pulls the curtain back on what's,
Stop.
yeah, exactly. Yeah. And so hopefully that's what I can leave you all with. But thank you so much.
Dr. McCabe, I was just going to self-report that I had the Yuka app and I removed it because I didn't like what it was telling me. But it convinced me to bring it back, so I've already re-downloaded it.
There's, I mean, especially in the beauty industry space, there are a lot of companies that exist, but also like, this is not just it's a people problem in the sense that not everybody can afford to change their products and to buy. I think it's fair to say that sometimes these companies exist and they are at a much higher price point, but there are products that are out there that are safe, that are reasonably priced. And so, I'm really encouraged by that too, that it's not just for those who can afford it that can be safe. So, yeah. All right. Well, thank you so much. Have a wonderful evening, and I'll hang out if there's any other questions.